We have an insightful session delivered by our gold sponsor, Cleveland Clinic Abu Dhabi, on how we can drive value in healthcare through the digital innovation. That will be presented by Madhu Sasidhar. Madhu is the Chief Medical Officer at Cleveland and Clinic Abu Dhabi. Please join me in welcoming him.
Good morning.
Good.
So today I'm going to present how we can leverage and utilize digital innovation to drive value in healthcare. So recently there has been a lot of discussion about healthcare technologies. Many of you have probably heard or read, and please, a show of hands, if you've read about how artificial intelligence or robotics can replace your doctor, please raise your hand. Oh my God. As a physician, I thought it was amusing, but now I'm a little bit threatened by it. But you also heard about several other technologies even during the course of this conference. So for example, we saw virtual reality, augmented reality. We saw examples of a digital persona that looked incredibly human-like, blockchain, and of course, mobile apps. There's been an explosion of mobile apps in healthcare field, from apps that will diagnose conditions such as a skin rash if you take a picture, to apps that will manage your healthcare data and your fitness data. It's literally a jungle out there, and hardly a week goes by without somebody asking me to evaluate a technology in the healthcare space. So how do you make sense of it? How do you figure out what has value? What technologies should I adopt now because it can deliver value to the patient? What technologies should I wait on while they mature? And what are the technologies that today have absolutely no value for patient care? So today I will present a framework that may perhaps inform you and guide you as you make your selection of the type of technologies that may have value in healthcare. Simply, value in healthcare is quality, service, and access to care divided by cost. So when I evaluate a technology in healthcare, I look at the technology and see how can it contribute to quality of care, how does it contribute to service excellence, and how does it contribute to access while keeping an eye on cost. And during this presentation today, I'm not going to talk much about cost, but I do want to emphasize that cost is incredibly important in healthcare. In most economies, the cost of healthcare has become unsustainable. In the US, for example, healthcare now is the largest sector of the economy. 1 out of $5 that is spent on healthcare. So when we evaluate a technology in healthcare, the question that we ask is not how much is this going to cost me, but rather, how is this technology going to take out cost or eliminate cost in my delivery of services? So if you take a look at those 3 items in the numerator, quality of service and access to care, broadly, when you evaluate a technology, you can put it into 2 buckets. There are technologies that directly impact clinical care and therefore patient outcomes. And then there are technologies that affect business processes. Now, business processes in healthcare are incredibly complex, and there is a lot of friction, and these processes are prime for disruption with technology. Access to care, for example, is one of the leading challenges for healthcare organizations. It does not matter what kind of insurance you have or where you live, getting to the right provider at the right time remains an incredible challenge. If any one of you has made an appointment with a healthcare provider or has had to make that on behalf of someone in your family, you know how hard it is to find the right specialist for the kind of symptoms that you have or the condition you have. And even when you make an entry into the healthcare space, coordination of care between different specialties, between your diagnostic tests and your therapeutic procedures is incredibly hard and is very frustrating for our patients. For a hospital, one of the most incredible challenges is allocation of operating room resources. The operating room is the most expensive resource in the hospital, and it's not because of the expensive equipment that's there, but also because of the staff that is required to run a hospital. The resources that you will need to do an eye surgery are very different from the resources you need for a heart surgery or a gynecological surgery. Above that, you have to accommodate emergency surgical procedures and the schedules for surgeons who like to go on vacation and attend conferences. So the day-to-day management of an operating room is incredibly complex, very labor-intensive, and is highly inefficient. So when we looked at this problem at the Cleveland Clinic, what we saw was an opportunity to use artificial intelligence models to solve this problem. And the model that we selected is not very different from the model that some of you may have heard yesterday in the trucking industry, where they were shipping pallets around the country and trying to get them back. What we used was an artificial intelligence model, a time series forecasting model, to look ahead for 2 weeks and predict out for 2 weeks what kind of resources would be needed in the operating room. And by utilizing this AI model, we are now able to better match the resources in the operating room to the patients who need them. Today, we are taking that model that we developed in the operating room and modifying that so that we can use the same kind of model in our outpatient clinics so that we can serve our patients better. Patient experience is how we measure service. Service is one of the items on the numerator of the value equation. And there are some great examples of how healthcare organizations are leveraging technology to enhance patient experience. And later in the presentation, I would like to show you a great example of an AI-enhanced digital agent that we have adopted at the Cleveland Clinic to provide context-sensitive help to patients who are looking for an appointment. Now, in terms of outcomes, and you may have heard some of this in previous talks as well, AI, machine learning have already started to make a tremendous impact on patient care, starting with things like drug design, where an entire drug design can be done using an AI model, or running a randomized clinical trial, which can also be done using data without involving actual patients. Today at the bedside, we have AI tools that help us in patient care. When I'm looking at a CT scan of a chest, an AI model can tell me that a spot is likely to be cancer. At the bedside, there are tools that are embedded in the medical record that can warn physicians that a patient is likely to become septic, a dangerous condition due to a blood-borne infection. And outside of institutional care, public health, the biggest challenges in public health, such as malaria, tuberculosis, HIV, influenza, we can now pinpoint them and predict the size and nature of these infections using AI tools. While I highlight some of the opportunities with AI, machine learning, and new technologies, I also want to talk a little bit about the challenges and the true risks that are inherent to some of these technologies. And the first that you see on the left side is the human touch. Even the introduction of a technology such as an electronic medical record, it is estimated that now doctors spend up to 70% of their time interacting with the electronic medical record. For a profession where the human touch is incredibly important, this is a real risk. The second challenge is interpretability. I talked a little bit about these clinical decision support tools, such as pointing out a patient who may become septic. The problem with some of these tools is that it's a black box, especially when you take some of the advanced AI algorithms, such as neural networks. They don't tell the physician why the algorithm thinks that the patient is going to become septic. That's left to the physician to figure out. And what this does is it increases the cognitive overload on physicians. And finally, it is important to be cognizant of the data quality. Most of these machine learning algorithms are built using data that was collected for clinical care. This is not high-quality, curated data for machine learning. And if you put garbage in, it's possible that you may get garbage out. So for the ML algorithms that are used in clinical medicine, one of the real risks is that data that is going in is not the highest quality data. So the advantage of using a framework to understand value when you adopt a technology is that it optimizes your selection process. You're no longer attracted by what's the shiny new technology out there, but it allows you to understand what matters to patients. And what matters to patients is quality of the outcomes. It is a key differentiator for patients. It allows you to put your patients first. And very importantly, one of the things that we've recognized is that you cannot simply take a technology that was developed somewhere and apply it here without a culturally sensitive and culturally nuanced approach. It also allows organizations to solve their most critical problems, such as the OR resource allocation problem that I talked about earlier today. Some of the most impactful interventions in healthcare are not very technologically advanced. The picture that you're looking at is a picture of a heart transplant. This is a donor heart that is being prepped on the bench before it is put into the recipient's chest. There's not a lot of technology there, just a pair of hands and some instruments. And as a center it's the only center that does heart transplants, lung transplants, and liver transplants, we are taking care of a large number of patients who receive organ transplants. Outcome for these patients is not just dependent on the technical quality of the operation, but how you take care of them for months and years after the surgery. And for this outcome, for us to have good long-term outcome, we need technology. We need technology that allows us to monitor patients for drug toxicity, drug interactions, and infections, because these patients are on immune-suppressing medications and are likely to develop infections. So the best care, the best infrastructure, the best doctors is not very meaningful if your community does not know about the care that you can offer, or if they cannot connect with you. So access remains incredibly vital, and this is where technology can help. And it is important to make sure that the services that you offer to the community are the services that they need. When we opened our doors about 4 or 5 years back, the number one reason for patients to leave the country to seek health care was cardiac care. Now it's about 27th. Cancer is the number one reason why patients leave the country to seek care elsewhere. And we've responded by creating a comprehensive cancer care program and building a new cancer care center. So it is incredibly important that healthcare organizations are responsive to the needs of the communities that they serve. And increasingly, healthcare is moving out of the four walls of the organizations. It's moving into the community. It is moving into the homes of our patients. Patients are starting to self-manage their conditions, and this is becoming more and more technologically enabled. This is an example of a health fair that we held recently. This was in one of the new malls that had opened up in Abu Dhabi, and I was afraid that we were going to shut the mall down. There was an incredible mass of people who were interested in learning about lifestyle modification, risk modification, taking care of their disease, hypertension, cholesterol, heart disease risk factors in their home. There is an incredible appetite for high-quality, curated medical information. And it is possible to deliver that through technology, and technology allows us to reach a much bigger and wider audience than we would have otherwise through traditional means. So as we start to optimize our reach into the community, it is important that we understand the community that we serve. It's a young community. It's an incredibly connected community. More than 90% of our patients are connected, and they're connected to us using social media or mobile platforms or the internet. And it is possible today to turn all of that data into value by leveraging predictive analytics. The patient journey starts well before they come to see us, the moment they make contact through a web page or a mobile device, and it continues well after they have seen us. And it is possible to use technology to enhance this patient journey through the full spectrum of care. And as I said before, patient experience is going to be the challenge in the future. Healthcare organizations are going to compete on patient experience. When you think about it, it is incredibly hard to provide an enriching experience when someone is facing the most difficult time of their life. The most creative and innovative healthcare organizations will figure out how to use technology to enhance patient experience. So I'll leave you with one video, an example of how we are leveraging technology to enhance patient experience. There are a few takeaways from this video. The first is that you're going to see a an agent, a virtual agent helping a patient. But this is not an agent that simply performs tasks. This is an AI-enabled agent that leverages the concept of a team of providers to provide the right care to the patient at the right time with the right provider. Secondly, what you're going to see is that this agent is going to leverage a backend, an AI-enabled backend, to search through the patient's medical record and provide the patient with context-sensitive coordination of care. So if I can have the video next.
Hi, Brian. How may I help you today?
I'm having a chest pain and I'm not feeling well. Can you book the earliest appointment with my cardiologist?
I am sorry to hear that. Let me help you. Would you like me to call an ambulance for you, or would you like to see Dr. Waleed?
Yes, I'd like to book an appointment with my doctor.
The earliest appointment with Dr. Waleed is on Friday at 10:30 a.m. I can book that appointment for you, but I noticed that you already have an appointment tomorrow with Dr. Jamshed in DDI at 2:30 p.m. If you would like, I can schedule an appointment with another cardiologist on Dr. Waleed's team tomorrow at 4:30 p.m.
Okay, book me tomorrow at 4:30.
I'll book you tomorrow at 4:30 p.m. with Dr. Tuzku. Brian, please note that for this visit, you will need a pre-lab workup. Dr. Tuzku will place these orders now. Please ensure to complete the labs before your first appointment at 2:30 tomorrow. The lab team will be expecting you between 1 o'clock to 2:30 p.m. Please note that you don't need to fast for these lab tests.
Thank you.
Happy to help.
Thank you.